Hello, good evening, everyone. My name is Dr. Laz Eze, and I'm really excited to welcome you to Talking Health with Dr. Laz, your favorite health program on television. Of course, you are still watching Africa Independent Television, AIT. It's another Tuesday evening, and of course, you know that by this time every Tuesday, we always get to talk about health. And this time, we're going to be talking about an important subject within the health sector, and in fact, for all of us, it's about abortion. Yes, when the word abortion is mentioned, it sends different signals to different persons. But September 28th every year is marked as International Safe Abortion Day. And of course, it brings into discourse issues around abortion and how to make sure that our women are not dying, from that situation that is highly preventable. So in Nigeria, it's known that despite our highly restrictive abortion laws that only permit abortion to be performed when the health or the life of the woman is at risk, despite that, many persons on a daily basis are still carrying out this procedure. And in fact, data shows that at least 2 out of every 10 women who are dying from pregnancy-related complications is dying as a result of unsafe abortion. And also data shows that out of every 10 persons, 10 women who carry out abortion in Nigeria, 6 out of them are unsafe. So the question is, how can we prevent this death? How can we end unsafe abortion in Nigeria and save the life of many of our women and girls? To join me to discuss this today are 2 women who are strong advocates on sexual reproductive health and rights. One is a medical doctor. The other is a gender and development specialist. I'm going to be introducing them further after the break, but just before we take that break, please follow us on our social media handles at Talk Health Nigeria on Twitter, Facebook, and Instagram. And also subscribe on Talk Health Nigeria TV so that you always be able to watch the program, even after the live program. So let's take a break and we'll be right back. Do stay with us. Welcome back to Talking Health with Dr. Laz, your favorite health program on television. Yes, like I told you earlier, I have 2 guests who are going to be joining me to discuss this very important topic we are talking about today, how to end unsafe abortion in Nigeria. I have by my left Jennifer Amadi. Jennifer Amadi is a gender and development specialist, the founder of NICT Together Initiative and also the Vice President of AfriPod. You are welcome to the program, Jennifer.
Thank you so much.
Yes, also by my right is Dr. Chioma Nwakama, also popularly known as Dr. Zobo on Twitter, that she uses to do a lot of health education. She's a sexual reproductive health and rights advocate and also the founder of Smile With Me Foundation. You're welcome to the program.
Thank you so much.
Yes, you know, September 28th was used to mark International Unsafe Abortion Day. Let me start with Jennifer. You are also the lead for She Decides in Nigeria, and you're doing a lot of work around promoting sexual reproductive health and rights. So in your opinion, how can we end unsafe abortion in Nigeria? I just want us to go straight to the point on the solutions and not spending a whole lot of time on the problems.
Okay, thank you so much, Dr. Lars. And yes, I'll just give like 2 bullet points. I think if we have to end unsafe abortion in Nigeria, we can start by, should I say, expanding access to contraceptive services so that women and girls who desire to use contraception can do so, and when they use contraception, they limit their chances of, you know, becoming pregnant unintendedly. So that is one way that we can do it, and that has to be with government working together with development partners to expand that services for them. Then another one is I will propose expansion of post-abortion care. Yes, because yes, we have tough, restrictive, you know, law on abortion, but yet people procure unsafe abortion on a daily basis. Maybe we could begin also by expanding post-abortion care so that people are able to access services early on to, you know, minimize deaths, disability, and harm to their bodies.
So when you say post-abortion care, is it, what can you expatiate on that? Okay,
yes, many times people who get pregnant and are not ready to become parents or to carry the pregnancy to term, attempt to, should I say, begin the process of terminating their pregnancy. So in that process, they could, you know, fall into bleeding, or they could actually get themselves into one harm to their reproductive health or the other. And at that moment, maybe some of them are rushed to the hospitals. So the services or the health care they are given at that moment is actually post-abortion care.
Okay. So some might be like, okay, why should even someone terminate the pregnancy in the first place when our laws don't quite support that?
Yes.
Except where the health or the life of the woman is at risk. So let me come to you, Dr. Nwakama. Yes, as a medical doctor, we could go to speak a whole lot around issues about abortion. But let me start from even definition. Because when we say abortion, we may assume that everybody, you know, understands what we're talking about. So what is it?
Okay, thank you very much. In simple terms, abortion is just termination of pregnancy. And abortion can either be spontaneous or it can be induced. So popularly,
by spontaneous
means it can happen on its own.
The one that is called miscarriage.
Miscarriage, okay. Yeah. Popularly, people say, oh, I had a miscarriage. That's a form of abortion, but that is, the process started on its own, so it's spontaneous. Then the induced abortion is the one that is popularly known, where people start the process themselves using different methods available. So yes. Yeah, that's it.
Okay, so do you think this should continue? Or what's your opinion when it comes to, I'm kind of putting you on the spot.
On the spot.
So what's your opinion when it comes to voluntary, in this case, termination of pregnancy?
Okay, my opinion, that's quite dicey. As a medical doctor and as a Nigerian, the laws are clear. Even though I particularly have some issues with some parts of the law which are not so clear to me. So some people think that, you know, abortion is totally illegal here in Nigeria. However, it's not. There are clauses where it is permitted. We have the penal code and we have the criminal code, which says, I think the penal code is saying where it's, as long as it saves a pregnant lady's life, and the criminal code is saying as long as it saves her life, you know, and she has anything that could, this is me trying to make it simple, medically related or affects her mental health. But then it has, it excludes rape cases, you know,
okay,
incest
people
and
getting pregnant as a result of rape.
You know, it means they're saying the woman can terminate the pregnancy if it's affecting her health or her mental health or her physical health, except rape cases, incest, fetal impairment, and all that. And so when it comes to the mental health area, I feel it's a little vague, because when can you say, and particularly when can you particularly say this is affecting someone's mental health, especially when you're reviewing issues like rape, which can affect someone's mental health.
Well,
So
the Violence Against Persons Prohibition Act,
yeah,
you know, makes provision for if the health, you know, comprehensive medical care
yeah,
for victims of rape,
okay,
right? So that's comprehensive medical care. You know, neither of us is a lawyer here to try to give explanation to that, but one will be wondering what's the component of comprehensive medical care. Of course, comprehensive health care includes the physical, social, mental well-being.
Yeah.
So, but it's open to interpretation.
Interpretation.
You know, because the VAP Act, where it's applicable, has essentially repealed, be it the penal or the criminal code, depending on which part of the country is applicable. So, but coming to use of contraception, according to the National Demographic Health Survey, although the data speaks mainly to married women who need contraceptives, 36% of them need it, only 17 are getting it. You know, it didn't quite get you know, deep data around unmarried, single, young girls, you know, who might also need those. Is debatable. You know, some persons feel that if you're single and unmarried, what do you need contraception for? So let me put that to you, Jennifer. So if someone is single and unmarried, what does a person need contraceptives for?
Yes, I just have to smile because first of all, we're actually sexual beings, and remember that age bracket says 15 to 49. So within 15 to 49, we'll have adolescent and young persons who may be married or who may be single. So obviously, they are, in a way, should I say, taken care of in that statistics.
Yes.
But then that wouldn't give us a kind of comprehensive analysis of, should I say, the situation of young people and adolescents who desire to use contraceptive. But then I think it would be us living in denial when we refuse to acknowledge that young people and adolescents are having sex. And many of the, should I say, many of their sexual initiation lead to unintended pregnancy. And remember, they could be in school, they could be in secondary school, they could be in tertiary school. And when they are in school, they need to complete their education. And when they fell pregnant, then there is the likelihood of them, should I say, pausing their educational process, which also will affect their future, should I say, affect their dreams or affect them achieving their aspiration in life. Then that is when it becomes very important to them to try to initiate unsafe abortion. And when that happens, it really contributes to maternal mortality rate.
So we should be talking more around, okay, yeah, how do we stop that from happening? So from what I get is, the reality is that people, young people, are engaging in sex despite the abstinence that is, you know, strongly recommended, you know, so they are engaging in it. So do you support comprehensive sexuality education for young people?
Yeah, I was going to mention that if you didn't. So thank you for bringing that up. I think when we're talking about ending unsafe abortion, there are different levels: primary, secondary, and tertiary. The primary level of prevention is education. And it has to be comprehensive. It shouldn't leave anyone behind. You know, I think one of the reasons why people feel that contraceptives are for just married people, let's start with the language we use: family planning. So when you hear family planning, it's not inclusive. If you are not married, you're not going to feel, I don't have a family, so what am I planning for? So I think we need to also check that. And then in...
but some people may argue that even if someone is single, sometimes they say they put someone in the family way.
Family way, yeah, I understand
just having a
that's
baby.
Logical, do you understand? But not everybody has that level of understanding. We need to be very basic in our medical language, because medical terms can be a bit confusing and so it's just very big, you know. So I believe that comprehensive sexual health education is very important and age appropriate for every level, as long as a child, when a child is born, as long as the child can understand, you know, you give them age-appropriate sexual education. And the people who give them this sexual education has to be their parents as they're growing up, right? And so it means we also need to equip their parents, because they need to know what to teach. Yeah, they need to know what to teach. So we need to teach these teenagers, because the more we teach them, people feel like sex education is teaching people to have sex or encouraging them to have sex.
It makes them, helps them to
it's actually telling
decisions.
them the options and helping them make informed decisions. And, you know, some statistics, I think we talked about that yesterday, some statistics mentioned that the more children are even educated about this, the more they, you know, they delay in, you know, carrying out sex, and even whenever they do, it's safe sex. At least you know that you've curbed one form of that.
Yes, I think you asked, let's take a break. You know, when we come back, we're going to, you know, get more insights from our guests about this topic. But don't forget to also keep sending your own opinions on social media. You know, we identify some of them and read it out in the course of the program. Please stay with us. See you after the break. Okay, welcome back to Talking Health with Dr. Laz, your favorite health program on television. We've been talking about how to prevent unsafe abortion in Nigeria, how to end it completely so as to save many lives. You were about to speak before we went on the break, but there's a data I think is important for us to note. In a study by Professor Konofua some years ago, he identified that 80% of politicians and policymakers interviewed admitted that unsafe abortion is a major cause of maternal mortality, right? 80 agreed. But only 20% favored the amendment of the existing laws, you know, from, you know, making, like allowing for comprehensive sexuality education and some of the recommendations that are being made. So what do you see through that? Because some have argued that you need to make the laws, you know, less restrictive. Others have argued that, you know, you should even make the laws more stringent. So which part of the divide are you?
Okay, why I make my contribution to that, I would like to point that actually there has been quite a lot of programs targeting young people, and it's no longer called family planning, it's now called life planning.
Okay.
Yes, I just want like let us know about that. And actually the HIV and AIDS education program in Nigeria, which is called FLHE, Family Life and HIV and AIDS Education. So it now has incorporated the aspect of life planning with strong component of, should I say, life building skills which is assertive negotiation and decision making.
Has it reflected in our national policies?
Yeah, it does. Currently, a particular, should I say, international implementers, they are working on that. But I know in Rivers State has reviewed its FLHE program to now become a standalone. It's no longer taught in combination of integrated science or biology. It's now taught as a standalone
subject.
Yes, and it's being taught across junior secondary schools in the state right now. Yes. So to this conversation you just said, I think what could be the reason is mindset shifts. As much as we're talking about providing comprehensive sexuality education, we also need to provide comprehensive education to our parents, to our guidance, to really understand that when we provide this comprehensive sexuality education to our children, we are not in any way encouraging or, should I say, inspiring them to indulge in early and indiscriminate sexual behavior.
Great. So comprehensive sexuality education, you also talked about that. So let me quickly, because we'll soon be rounding up, some messages we got on our Facebook platform. Ede Ogbonia said, unsafe abortion may not end in Nigeria if primary and secondary healthcare systems around the country is not made to work with good referral systems. Enough doctors and nurses patient ratio increase with possible penalty placed on illegal abortions by quacks at every corners of the country. We can't continue over-laboring our tertiary healthcare with far less workers daily. So I think you can relate to this.
I can.
Just before you respond to that, I think there are two other comments. This one says how to prevent unsafe abortion in Nigeria through proper education and enlightenment on the consequences of inherent on unsafe abortion. That's from Dan Owofen. And Mwabasude said true rural enlightenment, which agrees, to the points you've made. So what do you say to the point on health workers, primary and secondary healthcare?
Okay, thank you. For primary healthcare workers or the primary healthcare system, for me, that's the essential part of the healthcare system, right? So you cannot talk about post-abortive care or any care around abortion or even ending unsafe abortion without tackling that aspect. The primary healthcare system is the aspect of the healthcare system that reaches the people.
Yes.
So if you want to tackle the issue of unsafe abortion, I like to say that why are people, I first ask the question why? Why are people aborting? It means they don't want the pregnancy, right? And what leads to pregnancy? Of course, is sex is the most common cause of pregnancy. Now, if we can be able to tackle it from the roots, so people are having sex, we need to educate them about sexual responsibility, the things that come with that. Educate them, because even if you're saying give access to contraceptive care, some people, you still have some people who don't want to accept that no matter what you say. Educate them on how important it is, and then educate the healthcare workers too when they come to receive contraceptive care, to know what to do. So it's a holistic thing. Yeah,
thank you very much. We wish continuing, but our time is very far more spent. So what I get from this conversation is we do some kind of primary prevention, which begins from educating people. There's a lot of stuff around education.
Yes.
So when they have knowledge, right, they are going to make the right decisions and not even get pregnant in the first place when they are not ready for it. So that's how we can prevent unsafe abortion in Nigeria. So we are going to end it here, and we really thank you for staying with us. When it comes to issues around unsafe abortion, it means that we should even stop the pregnancy that is not wanted, so that we are going to enjoy it, prepare for it, and take care of our babies whenever they come to us. So this is Talking Health with Dr. Laz. We thank you for watching. Keep following us on our social media handles, and let's keep the conversation going. Thank you, and see you next week.